next we call upon the last speaker, Dr. AIOC2024 for her presentation on to correlate the efficacy and safety of interferon alpha 2B and surgical excision in the management of OSSN.
Good afternoon, everyone. Today I'm going to present my paper on to collate the efficacy and safety of interferon alpha 2B and surgical excision in management of ocular surface neoplasia. Ocular surface squamous neoplasia is a broad term encompassing conjunctival intraepithelial neoplastic lesions and invasive squamous cell carcinoma of the conjunctiva and cornea. Mostly it is unilateral, seen in middle age and older patients. It is an elevated conjunctival lesion seen at near the limbus with the blood vessels in the intrapalpebral region. A few patients may present with redness, irritation, foreign body sensation. Mutagenic effect of the ultraviolet B is related to combination of ultraviolet B induced DNA damage. Primarily P53 tumor gene is affected and impaired DNA repair mechanisms is seen. Most common associated risk factors are ultraviolet B radiation, exposure, human immunodeficiency virus, human papilloma infection, and exposure to the petroleum products. Lesion morphology ranges from gelatinous, leukoplakic, papillary, nodular, nodulo-ulcerative, being nodular and papillomatous lesions with higher histopathological grade is seen. What is known? OSSN is important because they mimic as an indolent lesions like pterygium and have a potency for ocular morbidity and mortality. Two major risk factors is ultraviolet B radiation exposure and human papilloma virus infection. Lacuna of knowledge, as we know, in previous studies, medical and surgical treatment were combined in management of OSSN. Therefore, this study will compare the surgical and medical treatment separately. The aim is to compare the medical and surgical treatment in OSSN, objective to evaluate the outcomes, to identify the characteristics associated with successful OSSN treatment and with OSSN recurrence, and to describe the adverse events associated with surgical and medical treatment. This is a prospective interventional study, hospital-based, conducted over a span of 1 year. Two groups were divided. 3 patients received topical interferon alpha 2B, 1 million international unit per ml, 4 times daily, whereas 3 patients with lesions less than 4 clock hours and less than 5 mm were undergone surgical excision, and the patients were followed at first, third, and 6th month. Inclusion criteria: age more than 18 years and confirmed cases of OSSN on histopathological examination. Exclusion: less than 18 years of age, patients with pterygium, with severe dry eye, pregnant or breastfeeding females, in previous surgery or topical chemotherapy in the presenting eye, invasion of adjacent structures like lacrimal puncta, plica, caruncle, and other intraocular compartments. What we have observed, we have taken 3 patients with the median age group from 47 to 55 years of age, with 2 male and 1 female patient. And 1 patient was having HIV for 7 years, and the female was having a history of UV radiation exposure, and laterality was unilateral lesion was seen in all the 3 patients. So this is the first patient we have before the treatment, and this is the post-treatment after 3 months. There was complete resolution. In the patient 2, this is the first photo before treatment, and after treatment, this is the picture of partial resolution at 3rd month. And this is patient 3 before treatment and after treatment, which was followed at 3rd month. In the surgical patients, there were 3 patients taken, 2 of male and 1 was female. And 1 had a risk of history of smoking for 20 years, and other patient had HIV for 11 years. And all lesions were unilaterally present in the eye. This is the first patient before treatment and after treatment at 2nd month, and the patient had recurrence at 3rd month. Patient 2 before treatment, and this is the after treatment picture at 3rd month, which a complete resolution was seen. And 3rd patient before treatment, after treatment in the 2nd month, and after 3rd month we have seen recurrence with positive margins. Result: a total of 6 patients were taken, mean age of presentation of 50 plus minus 10 years. Complete tumor resolution was achieved in 2 tumors following topical interferon alpha 2B for a median period of 6 months. Out of which 1 tumor with partial resolution, tumor surface area was reduced around 44% during 4 months. Adverse effects were seen in patients who did not follow the cold chain with interferon alpha 2B. And surgical removal of the tumor involved macroscopic free margin of 4 mm to ensure complete tumor resection was done in 3 patients. The recurrence was with the positive margin in 1 patient, whereas the other with negative margin. In 2022, Kinsko et al. Had done a systematic review and meta-analysis on OSSN. He had a comprehensive literature research to compare the topical pharmacotherapy 5-fluorouracil interferon mitomycin C, which was given to surgical excision regarding the clinical success, that is tumor resolution. And what he found was the topical pharmacotherapy with all three agents is as effective and well as tolerable as surgical excision in terms of tumor resolution. So what I conclude here is the topical interferon alpha 2b was found effective, relatively safe therapy in management of OSSN in comparison to surgical management, though the surgical management shortens the period but with high recurrence rate. Thank you.
Thank you.